Welcome to MedX channel. Today we are going to talk about wound healing. Okay, wound healing is an important topic. It discusses a lot of things. If we talk about wound healing, we talk about mainly three words. Okay, those three words are primary intention. Primary intention means there is closure by my main sutures. Okay, whereas skin edges are directly closed within hours of creation of the cut wound and approximation of the edges of the wound. Healing is normally good with minimal scar formation. Okay, let's talk about secondary intention. Secondary intention mean that wound it is left open to heal, left open to heal by combination of contraction and re-epithelialization. Okay, this is when there is no sutures but it left heal by itself. Let's talk about number three. Number three is there is delayed primary. This means that I will use my own sutures, but not at the time of the cut wound. This is done by using antibiotics and sharp debridement to get the wound cleaned before the primary intention. So, we talk about three words about wound healing. What are the phases of wound healing? Phases of wound healing, it is also three words. The first word, it is inflammation. The second is proliferation. And the third, it is remodeling. Okay. Let's talk about inflammation. Before the inflammation occurs, there is also homeostasis. And homeostasis, it is the body try to stop bleeding of the wound. Okay, let's talk about the first actually phase of the wound healing, which is the inflammation. The phase of inflammation, it is started at the first 2 to 3 days, and in this phase there is typical antigen antibody reaction when the thrombus release growth factors like BDGF. Okay, the endothelial cells swell and allow the polymorphonuclear lymphocytes and mononuclear cells to get into the surrounding tissue, and by this mechanism there is inflammation. As we see in this picture, the inflammation of the white blood cells move and clean the wound, and this is done by releasing of growth factors. These growth factors allowing polymorphonuclear and mononuclear cells to get into the wound. So let's talk about what is the functions of the mononuclear and the polymorphonuclear. Let's talk about the macrophage, which is mononuclear leukocytes. Macrophages are essential for normal wound healing, and wounds depleted of macrophage heal slowly. Okay, they debride tissue and remove microorganisms. Okay, this is the mononuclear. And also coordinate the activity of fibroblasts by releasing growth factors, including interleukin 1 and tissue necrosis factor, which transform growth factor and transforming the growth factor beta. Okay, and let's talk about the functions of growth factor that is secreted by macrophages. What are the functions of growth factor that's secreted by macrophages? It is acts as chemoattractant. This means that when there is any body that is strange from the body, it is act like help. There is something here, and they try to remove it. Okay, this is chemoattractant for fibroblast also to build the tissue that is damaged, and macrophages. Okay, it is helps in induction of angiogenesis, and the angiogenesis, it is essential for removing the bacteria. Okay, and there is stimulation also of extracellular matrix deposition. There is 3 isoform of growth factor that has been identified. Type 1 and 2 promote wound healing and scarring. Wound healing and scarring. And type 3 decrease wound healing and scarring. And in the future, we may have a role as an anti-scarring agent. So we love type 3, and we try to use the type 3 in the anti-scar reagent. Okay, let's talk about the growth factor beta. Is not present in the fetal wounds, and may be one of the factors that is responsible for decreased inflammation and improved scarring observed in this time. This is the growth factor beta. Okay, let's talk about the second phase, which is the proliferation. The proliferation starts from the day 2 and lasts for 3 to 4 weeks. And proliferation overlaps with inflammation. The macrophage within this tissue release growth factor, which are chemoattractant to fibroblasts. Fibroblasts are usually located in the perivascular tissue and migrate along network of fibrin fibers into the wound. The fibroblast secretes something called GAG and produce collagen and the elastin, which is the main component of the skin. The GAG consists of protein core that is surrounded by disaccharide unit. When hydrated, the gag become ground substance. Okay, let's talk about number 3, which is remodeling. Remodeling, this phase begins from 2 weeks to 4 weeks after injury. The proliferative phase subsides, and during remodeling the phase, there is remodeling of the phase. There is no net increase in collagen, and the extensive capillary network produced in the proliferative phase begin to involute. The collagen fibers at this phase initially start to being subside in haphazardly manner to become arranged in more organized manner. As in the proliferative phase, this is the collagen fiber. It is haphazardly manner, and in the time of remodeling, this is the fibers in more organized manner. Okay, let's talk about myofibroblasts. This cell that is was first identified by someone called Capini in 1971. It is resemble fibroblast, but different in that contain cytoplasmic filaments like smooth muscle, and those responsible for wound contraction. The myofibroblast within the wound, it is proportional to its contraction. Increased number of myofibroblast has been found that in the fascia in the patient with Dupuytren contraction. They are thought to be responsible of abnormal contraction of this tissue. Let's talk about epithelial repair. This process, there is epithelial continuity and re-epithelialized and re-established across the wound, consists of the following 4 phases. In the epithelial repair, there is 4 phases. The first one, it is mobilization. The second, it is migration. A third, it is mitosis. And the fourth, it is cellular differentiation. Okay. Mobilization means there is loss of contact inhibition. What it means? The epithelial cells at the wound edges enlarged and flattened. They detach from the neighboring cells and the basement membrane, and they then move away from adjoining cell. And as the stage of migration, there is decreased contact inhibition promote that cell migration. The cell migrate across the wound until they meet those from the opposite wound edge. At this point, the contact inhibition reinstitute and the migration ceases. And let's talk about number 3, which is the stage of mitosis. The epithelial cells begin to proliferate when they have covered the surface of the wound. And the last phase, which is the cellular differentiation, the normal structure of stratified squamous epithelium, it is re-stabilized, and the cell that differentiated and the layer of the structure of stratified squamous epithelium, it is reconstituted. Okay, let's end this video by the last thing, which is the fetal wound healing. Fetal wound healing. The tissue healing during the first 3 months of the fetal life occurs by regeneration rather than scarring. Regeneration rather than scarring. Regenerative healing, it is characterized by the absence of scarring, and this is the future of anti-scar measurement. Okay, regenerative wound healing differs from the normal adult healing in the following way. Inflammation, it is reduced from the adult. Epithelialization, it is more rapid. Angiogenesis, it is reduced, and collagen deposition is rapid and not excessive and more organized. And if we talk about collagen, it is in adult type 1 and type 3. It is come 4 to 1. But in fetal life, the collagen, it is differs. It is 3 to 1. The wound contain greater proportion of water and hyaluronic acid, and lack of growth factor in the fetal wound, and this is responsible for some difference. Okay, I hope you get benefit from this video, and let's recap. The wound healing composed of 3 phases mainly: inflammation, proliferation, and remodeling. Inflammation, there is chemoattractant, and there is mononuclear cells, and there is neutrophils that come to the site of the wound to induce inflammation. And the proliferation, there is the fibroblasts that secrete collagen in haphazardly manner. And in the remodeling, there is more organized tissue, and there is also increase in the collagen. I hope you get benefit from this video. Don't forget to like the video and subscribe the channel to get more videos. Thank you for watching.